right now with Dr. Joseph Mealy about facelifts. We'll be taking your calls with any questions you might have. Here's the number, 800-440-4884. We'll also be posting the number for the doctor's office during and at the end of the segment. Remember, any advice we give you today, you certainly want to consult your own physician as well. How many people have gotten facelifts, let's say, over the last, like, 2009? Is this a popular procedure?
It's a very popular procedure. It's always in the top 10, often in the top 5 procedures that we perform. In comparison, procedures like liposuction, about 400,000 a year. Facelifts, probably a little less than 100,000 a year. But it's hard to count all the mini facelifts, which are sometimes done in the office.
Okay, so you introduced that. I wanted to ask you about that.
Sure.
Mini facelifts versus what, maxi or just regular?
Just regular old facelifts or neck lifts. There's kind of a blend between the two of them.
You brought some pictures. Let's go ahead and look at those and then talk us through it so
Sure.
we know what we're looking at.
So here's a patient on the left side is a before picture. A lot of loose skin on the neck in particular and the jowl, so the lower part of the face, as well as descending of the cheek. We talked about gravity working. The cheek pad will drop down and give more projection on the lower part of the cheek rather than the upper part of the cheek where we like it, which makes the lower eyelid look longer, which is also sort of an aging
Is
appearance.
this a mini or a regular facelift?
This is a real facelift. This is a full facelift. So with this, there's an incision that's hidden around the ear in order to bring all that skin up and out of the way. And with that incision, I can kind of ease the hem or get rid of where that redundant skin is.
And I'm not going to be so rude as to ask this woman's age, but is there an age at which people really start to look at something like this?
It varies with how the face is aging. So I will see people who are younger, in their 30s, where you wouldn't think, oh goodness, we shouldn't be doing a facelift. You may think we shouldn't be, but their face may have the features that can be corrected with that type of procedure. Let's
get a look at the second picture that you brought. So.
This is also another full facelift. Again, we've cleaned up along the jawline. I've got some, there was some jowling there before, which I've been able to get rid of, remove a little bit of that fat and tighten up the skin, relieve some of the folding at the nasolabial fold and along the marionette lines with those lines that run from the nose down to the chin.
And the neck as well.
And the neck too. Yeah, we've got rid of that loose skin on the neck. Also did an eyelid surgery on her too, so just to be honest with what we're doing.
Okay, and she looks considerably younger. What do you think it bought her about 10, 15 years?
It's a remarkable change. It's probably 10 to 15 years, yes.
All right, and do you have one more picture here? This one is the mini.
And this is a mini facelift. So a mini facelift can get rid of extra skin that's on the neck and on the lower part of the face. It can't get rid of it as well as a full facelift because we're not going underneath that skin. We're really just staying up around the ear and tightening what's there. It can help with the nasolabial folds, and it can help with a little bit with the cheek. But again, I can't work directly on that cheek fat pad like I can with a full facelift.
Okay. Do we have any other pictures?
I think that's it.
That's it. So when we talk about a mini facelift, what's just mechanically, can you describe what happens as opposed to a full face, and even the full facelift, what goes on there?
Sure. With a mini facelift, as the name implies, we're doing a little bit less. So with a mini, I'm trying to get rid of extra skin by just tightening what's there. I'm not going down underneath the skin. I'm not really taking care of the muscles underneath here, though I can tighten the SMAS, which is a deeper layer underneath the skin in this area. Mini facelifts cause less swelling. They have a quicker recovery. Usually a week is pretty good to get back to looking normal. But the longevity is not there because we're not fixing the underlying structures like we are with a full facelift.
You mentioned something about longevity. So how long does this last?
No, a mini facelift, I expect it to last 5 years, somewhere in that range, whereas a full facelift would be more like 10 years.
Mary from Piedmont doesn't want to actually go on the air to talk to you, so Mary, I'll ask the question for you. She wants to know, can a neck lift be done as an alternative to a full facelift?
A neck lift has specific indications, just as a facelift does. Normally when we talk facelift, we're talking about restoring from the eyes down to the neck. So a facelift normally includes the neck as part of what I do, at least for a facelift. So it wouldn't make much sense to get rid of everything here that's causing aging and leave a lot of skin down underneath. And they usually come together.
People who, let's say they've got the jawline, everything is okay there, but the neck somehow ages prematurely?
Absolutely.
So what do you do with that?
And with that, then we would just sort of concentrate on doing the neck lift part of the facelift. They may not have trouble with the cheek. They may not have trouble sort of in this area. May getting mild. Usually it'll get mild jowls if the neck is starting to loosen. That certainly is corrected with the neck lift.
You know, some people complain about through age or maybe weight gain that they lose the definition in their neck. And do you do liposuction?
Liposuction helps if there's some fat to remove. So liposuction basically is just sneaking in through a small incision here, removing that fat that's between the skin and the muscle layer that's underneath the jaw. If the skin itself is frankly loose, liposuction is not going to do a great job to tighten it. We're still looking for the perfect technology that will tighten everyone's skin.
All right, we need to take a quick break. For more information about Dr. Mealy, you can call him at 925-943-6353 or check him out at his blog at sanfranciscoplasticsurgeryblog.com or go visit his website at drmealy.com. And when we come back, we will be talking about some do's and don'ts when considering a facelift. Plus, we'll be taking your phone calls.